The forum's been operative for several years now, and what that means for us is that we're able to make relationships, and our staff know staff from other agencies who contribute, and that's been really helpful to us as this health emergency approached. And since the health emergency has arrived here, the local resilience forum has altered its structures, which means that we're able to work through various cells so that our response to it can be as effective and as efficient as possible. So if we look particularly at the humanitarian cell as an example, and then we go further down to the shielded cell, some of the Merseyside staff that we will talk regarding have altered their roles. So fire prevention officers who might go into people's homes on a daily basis, into vulnerable people's homes on a daily basis. We've not necessarily been doing that for obvious reasons, so what we've been able to do is to redeploy our staff in line with the needs of the Merseyside Resilience Forum.
We've forged great relationships with Liverpool City Council over the years, and this has enabled us to support each other from the outset. We were quite fortunate enough that because of our relations we could quickly build a referral pathway because of our standing in the community. From the initial contact we mobilised within 4 days, ensuring all safeguards were met, and we had a clear set of operational guidelines to ensure that the safe and effective management of the scheme. So following on from the successful pilot in Liverpool, within weeks we were then able to start delivering the prescription services to the other 4 local authority areas of Merseyside. We utilised our home safety team throughout while still delivering high-risk home fire safety visits to those most vulnerable. And during these times we were also able to refer back to key services if issues were highlighted, in particular social isolation.
When we first started delivering prescriptions, the number of referrals we received was much more than I expected. As a service, we had to give priority to those people based on when they were due to run out of the medication. We contacted each person directly to ensure that all of the details were correct, and then liaised with the local pharmacies to confirm it was ready to be collected. We were delivered to the properties, ensuring we maintained the appropriate social distancing, and reaffirmed the details once again to ensure it was delivered to the correct person. Throughout the whole period, the response from the public has been amazing. We've met some really wonderful people who were really appreciative of our support and have called upon again. We'd be ready, willing and able.
Well, primarily we're a fire and rescue service, and our business will always be around fire and rescue and preventing fires happening in people's homes. But make no bones about it, we've learned around this particular time. So we've learned some ways of working that we might want to carry forward. For example, we'll talk to people on the telephone before we visit their properties to give them fire safety advice. But also, the important bit that we've sort of the important bit that we've contributed to in terms of prescription deliveries. We know that this has not yet gone away, and if it doesn't go away, we know that we can stand up our staff from one particular area of our business, and we can support our local resilience forum partners in areas of their particular business where they may be struggling.